Henry Ngethe is in the hot seat in the Situation Room this morning, and we're talking matters nutrition. Henry, good morning to you, and karibu sana to Kenya's biggest conversation.
Good morning to you too. How are you?
Very well, thank you. Henry is the chairman of the Nutrition Association of Kenya, and we're having that nutrition conversation this morning. What you put in guarantees what you get out, but let's put in some wisdom. CT has today's proverb from Niger.
This is our final proverb from the country of Niger. A man who lives on the banks of the Niger should not wash his hands with spittle.
Wow.
What do you think about that, Henry?
I think it's quite an interesting saying because whatever you put into your mouth at the end of the day determines your output, as you've well put out. And it's very important to note that our bodies are fueled by what we eat. And the output that we get is determined by the foods, which in most cases are can be poisonous, and some other times can be something that builds the body. When we talk about nutrition, there are two things that comes into my mind. Number one is that whatever we eat determines the energy that we have. Number two determines what is important and what at some point might cause disease. And the food that we eat determines two things. Number one, the foods and how we prepare it. And number two, does it give you what we need? And one of the biggest things that we are suffering as a country right now is the issue of the non-communicable diseases, which are brought about by the foods that we eat in most cases, because there is one thing that we have really negated, the aspect of discipline in what we do. We still and have the information, and some people do not have the information of the foods that they should consume. And therefore, that is where the problem is, because we have the information, or some people do not have the information, but then they do not focus on it.
Okay, well, if we were to now do some basic definitions of things, oftentimes we talk about nutrition and food and we lump them together, and it's clear. I mean, if I'm eating food, then I'm feeding my body with nutrients. So what would be a definition of nutrition in the real sense?
Thank you for that question. Number one, I'll talk about safety. Because even if you are talking about that plate that you have on the table, how you prepare it is very important. Because we are at a situation where we are using a lot of herbicides and a lot of pesticides on the crops that we are growing. That is number one. And you realize that whatever is happening in the streets is something that really needs a bit of discussion, because you realize that whoever prepares the food, that mamamboga, uses one container or karai to wash, or most of the vegetables, for example, that they use at the end of the day, or whoever will come. A population of around 100 or 150 people will be washed their vegetables from one karai, meaning that if the vegetables had a bit of pesticides, whatever has been used the whole day will still be given to the person who will be 150th. Meaning that one of the serious issues that we have is the issues of food safety, before we even talk about that plate of food and how it should be presented. Number two, that is one. Number two, when that vegetable is cut to small pieces, then you go with it at home. And remember that you realize that whatever has been washed, you've gone with a bit of herbicides at home. And that is why we keep on saying it is very important for us to ensure that we clean our vegetables or fruits very importantly, so that by the time you're going home with that vegetable, it's clean and safe. We've left the aspect of saying should be nutritious. We are saying that food should be nutritious and safe. Because at the end of the day, that plate, because before you even talk about that plate, we've talked about safety of that food. So when you get home, you need to wash it nicely, again, before you even start preparing it. And then you have your plate, which now should contain a bit of starch. A bit of starch is divided into two. We have the whole starch and we have the refined starch. The refined starch is what a bit of population are consuming, because if you look at, for example, the flour that you use at home, it's the sifted flour, which means that it's highly sifted. It's readily available to the body when you take it, and that is why we are struggling with the issues of overweight in our population and obesity. And therefore, having said that, it's also important to note that the other part of starch is the whole foods, which we should be concentrating on. The whole foods should be the foods that are not sifted or are not refined. For example, we have the whole maize. We have maize that has only been sifted once, not highly sifted.
Yeah.
And we have proteins, which it's usually in two different types. We have that one from the plant sources and that one from animal sources. The ones from plant sources, we have, for example, we have beans, we have legumes, and so on and so on. And then we have the ones from animals. We have two types of meat. We have the red meat and we have the white meat. White meat is the most important, and it really helps because it does not expose you to low-density lipoproteins or cholesterol, which brings about problems at some other time and predisposes you to cardiovascular disease or disease of the heart.
Yeah. Is there any food that is not nutritious?
Yes, there is food that is not nutritious. For example, what I've just talked about, the highly sifted flour. And that is why the government of Kenya has come up with a very good strategy to ensure that whatever you lose when this process is happening, the process of sifting and refining it, we do what we call as fortification of foods. That is reintroducing nutrients or micronutrients or things that are very important for the body. They're introduced back in the process of sifting, because when this process is happening, the process of sifting the maize flour, a lot of micronutrients, very essential micronutrient, get lost.
Like in the husk, for example. So
Yes.
Nutrients remain in the husk.
No, wait. No.
Yes.
The maize that is then turned into flour has all these nutrients before this process you're calling sifting takes place, isn't it? So we sift and remove them. Then we look for something called fortification to return what we removed. Now, tell me, is this not a bit strange? Why do you remove it so that you can replace it? I mean, why don't you just leave it where it is in the first place?
In fact, that is why we say that the most nutritious and healthy food is the maize that has not been sifted as much.
So why allow the sifting?
Because of customer preferences.
They want a smooth finish, essentially.
Yes.
right?
And ugali, which is extremely white.
That thing was introduced to them and they've been used to it. Prior to sifting, see, I have this advantage of age. Okay?
Yes.
This sifting was brought about by business people in that particular environment.
Yes.
Prior to that, the sifting didn't exist. And then, because of the marketing that then took place, you were told the whiter that thing is, the better it is.
Yes.
And plus, when you eat it, it's lighter. It is good for you. It was always billed as being good.
Yes.
Now we are saying this thing is really not that good. Now, in my mind, we are now not combating nutrition, we are combating businessmen. Because the very same people will now come and tell you we have fortified.
Yes.
Now, think about this. If you were to buy a car and you're told what we're going to do with this car, the way it has come in, it has a stereo, it has the ability to provide you with a visual reference when you're reversing. It has sensors that can do all sorts of things for you.
Yes.
But what we will do, so that the car looks better, we will remove all these things. Okay?
Yeah.
Then, when you bought it, we will return them and charge you. Now, I mean, this whole process, if the government, now, this is not your purview, but I'm just asking as a nutritionist.
Yes.
If the government really wanted to ensure that people benefit, should they not then insist, because they have the power to say that in this country, you can mill all you like, but you're not removing the natural nutrients? Do you really think that if that is what is available, people will refuse to eat it? They will not, especially if you present it as something that is useful and healthy.
I look at it differently in terms of customer preference and whatever the customer wants. And you see, both of what you're talking about is available in the market. My point here would be us scaling up what you call as customer education or nutrition education to the consumers, so that then everybody is able to make their rightful and nutritious decision.
Okay.
And you see, number one, a long time ago, this, as you said, was available, but not as much. But, as people and as our country continued to modernize, things keep on changing and preferences keep on changing for the consumers. Because, number one, we have a lot of education on and information on the internet, and people are able to know whatever is happening to whichever country. People have traveled and they have seen some of these things. And you see, the more we have embraced the issue of refined foods, the more we start struggling with the issues of non-communicable diseases.
Okay.
And people are starting to realize that however much I want to live in terms of doing what you need to do, there is the aspect of NCDs or non-communicable diseases that people are struggling with. And if you look at, for example, the Kenya Demographic Health Survey that was released in the year 2022, you realize the situation is very serious. For example, women of reproductive age in the year 2014, in the KDHS that was released in 2014, the obesity and the overweight in our productive women was at 34% in 2014. In 2022, it's at 45%. It is going up. But the question is, what is happening? Where are we missing it? At that personal level, there's so much that needs to be done. Number one is nutrition education and ensuring that it's done. And it's done in the best way possible. Because the discussion that we are having, it's on nutrition and PHC, primary health care. So how do we do it? And how do we ensure that this population, this 45% of our productive women who are overweight and obese, how do we deal with it? Why is it that things keep on going up? It's simply because we have focused more on the refined foods.
So are we saying,
Yes.
based on what you've just preferred here, that there is a direct link between refined foods, overly refined foods, and then the lowering of nutrition in the body, which could then lead to some of these diseases that we've seen today, even as we go towards now primary healthcare?
Yes. You see, starch is the food that we consume and the energy that you get. You take much of it, the body will use what it requires and then stores the rest. When the rest is stored, that is what is stored in the body as muscle or fat. So it's basically food. It's basically food, what you're consuming if you don't want it as much, and then it's stored in the body. That is number one, the refined foods. Number two is the sugar-sweetened beverages. We are taking a lot of sugar-sweetened beverages. And that is why these sugars are being stored in the body. And we are doing not so much on physical activity. At our own personal level, you realize that someone has a very sedentary life. They live an office and you don't walk, get into your vehicle, get into your parking, walk 2-3 steps, you get into the house. On weekends, you sit down, watch TV or work on your laptop. You take your car, you drive, you don't. We should also focus on physical activity because that energy needs to be expedited.
Okay.
Yes.
There's been a lot of information more recently that you will see babies born.
Yes.
Who are, I'm not quite sure what the term is, but malnutrition is what we're saying. Babies born and they already have a condition of malnutrition. Can that be traced to the gestation period and how the mother ate that would then give this child this condition at birth?
Yes, there is what we call the vicious cycle of malnutrition, which now occurs from, there is what we call as the 1,000 days. Okay. The 1,000 days is when conception happens. Conception starts up to the age of 2 years. So, number one, it's very important to note that if, for example, a woman who is about to conceive is undernourished, it means that even the end product, which is this fetus and this infant, will also be undernourished. Remember that our body stores the micronutrients and all the nutrients that the body requires. And we are talking about the triple burden of malnutrition in Kenya right now. We have a population that is overweight, you have a population that is underweight, you have a population that does not have, that has a deficiency of micronutrients. So if this population conceives, it means that the end product will also have the same challenges that the mother or the father has.
And we're seeing this in Kenya today, that the two sides of the spectrum, overweight, underweight, and then here in the middle we have, so essentially you're saying we have an eating nation that is not eating the right foods on a daily basis that would, number one, either contribute towards children born malnutrition, or number two, or malnourished rather.
Yes.
And then people then at risk of some of these NCDs.
Yes, because as I've said, we have reproductive women who are 45% of them are overweight, meaning that the end product will also have some of these challenges if we don't work on it. We need to scale up some of the activities that we should target on this population. You see, it's going up. We have the exclusive breastfeeding rates in Kenya have dropped by 0.5%.
Why?
It means that for some reason, there is something that needs to be done by all of us. Starting at an individual level, and scaling it up to the community, to the health facilities, to workplace, because you're talking about workplace support for lactating mothers or breastfeeding mothers, and also to the population at large. We're also saying that it's very important for all of us to scale up nutrition education and to have nutrition specialists at that most basic unit at the community level.
So there's got to be a champion for some of these things from what we see, obviously, because you can have the conversation in your silo, in your home, by yourself, with your friends.
Yes.
But then if it is not being realized on a national level, that one points to another and then eventually ends up here, and then having that drive. I keep remembering Michelle Obama.
Yes.
In the US,
yes,
when she was very insistent on school lunches and what children were being fed, and how that now went directly to how they were then able to perform in school. No more junk, now try to have healthy foods. So you chair an association.
Yes.
What does your association do specifically along these lines? Because we're talking about a number of things here: the disease burden, as well as the malnourishment or the malnutrition burden amongst Kenyans today.
Thank you. Number one, Nutrition Association of Kenya is a membership association for nutrition professionals in Kenya and beyond. So what we basically do is that we impact our professionals with the current scientific and evidence information on nutrition and health. Meaning that there's a lot of information. You know, health and medicine is something that keeps on evolving each and every day because of the new science that keeps on coming up. So it is our responsibility to make sure that our members are impacted with this knowledge, and we're also able to look at what is the world offering in terms of this and science, and we cascade the same information, and we also ensure that the population gets the right information on nutrition, and that is why I'm here, to ensure that we cascade this good nutrition information, because nutrition is a marker for development for a country and for the growth of GDP. The hunger study that was released by Treasury and the Ministry of Health showed that Kenya loses close to 6.8% of the GDP because of malnutrition. And this is something that we really need to hold our hands and ensure that we fight this malnutrition. And as I had put it across there before, is that we have three spectrums of undernutrition. We have overweight, which we really need to focus and scale up nutrition education. nutrition on that and other activities. Number 2, we have undernutrition, which which I have said we all need to work hard to ensure that we eliminate it in Kenya. And number 3, we have the micronutrient deficiencies, which is a very serious thing that is in our nation, and we really need to start fighting it at our own individual level by ensuring that we do so many activities, which include, for example, what we were saying, consumption of fortified diets, ensuring that we increase a variety of foods in our diet. Because when we talk about micronutrient deficiencies, there is so much that needs to be done. Number 1, for example, we have, when we talk about fertilizers, and we do not check the acidity levels of the soil, it means that the soil becomes acidic at some point. And that is why the agricultural officers will keep on telling you that you need to keep on managing the pH. Because if the pH is high, the soil pH is high, it means that the plants are usually unable to absorb the micronutrients in the soil.
Right.
For example, the likes of zinc and chromium, which are very essential in human health. So if these micronutrients are not absorbed by the plants, and remember, our population consume these plants, what does it mean? Means that even these individuals will not have these micronutrients that you're talking about. The Kenya National Micronutrient Survey of 2011 showed that more than 60% of our Kenyan population is zinc deficient, which for me means that there is something that really needs to be done. Because if we do not focus on some of these micronutrient deficiencies, they cause a bit of other challenges. And a micronutrient deficiency is not something that you will see on someone. There is something that will come in. For example, a deficiency of chromium. At some point, someone might develop diabetes type 2. And so for us, we never think about a deficiency of chromium. We think about this diabetes that has come in.
We don't even know what chromium is. I mean, when you are buying food, you don't think, okay, well, let me buy this because it's got chromium. We don't think along those lines.
Chromium is complex. Zinc.
We don't think along those lines, really. When you're buying your vegetables or doing whatever that you're doing, you're not thinking, well, allow me to increase my levels of zinc.
But there's something I find perplexing, because when we modernize, what we in essence are selling is an improvement of lives and livelihood.
Yes,
it's called modernizing. And then when you look at the consequences of that modernization, say with farming, you certainly have additives that are supposed to make your yield better, your soil better. And yet this soil, as it was originally constituted, had these nutrients. It's not as though they needed you to add to it. Traditional farming methods, people understood crop rotation.
Yes.
And they also understood fertilizing, they understood manure, they understood all these things. And the story of acidity, if it existed, we probably didn't know it. But more and more, as we've sought to bring in modern ways of farming and fertilizers, this story comes up. So now, you are now discussing pH levels with a farmer now. I came across that word pH many years ago when I was studying chemistry. And I stopped studying chemistry by the time I got to Form 4. So I don't even remember what pH meant, but I know what the general thinking about it. Now, then we come to what that land produces.
Yes.
And then we talk about the person who tills that land. When you're a nutritionist, and I know the Ministry of Health has nutritionists, I know.
Yes.
How do you then get to explain to the mwananchi? Because the vast majority of our population is still in the rural areas, that this healthy living we're talking about is something that is within your grasp on a day-to-day basis. These foods that we call traditional food that you eat, these things can actually, are what you need to actually live well and live healthily. But that conversation is drowned by the high pitches of the sales for what commercially are considered to be modern foods, which are not necessarily nutritious. And yet, everything that we talk about with regards to food, traditional foods have them. I mean, how then do you get people to understand? Now, once upon a time, we had this concept, and I see it's coming back, of extension officers.
Yes.
Now we have community health workers, but the concept can be extended to community agricultural workers, community, all these things, so that the narrative that you are speaking of, that guarantees that people grow up in an environment where they understand
Yes.
that, yes, there are things you can modernize, but when it comes to your food, you had it right. We tinkered with it and sort of lost our way, but we had it right from the very beginning. How do you get this message across?
Thank you. With implementation, which is there, with implementation of primary health care means that the services that you get in a level 5 hospital, a county referral hospital, now it's being cascaded down to the community level. That means that the services of a nutritionist will be gotten at the community level. When you have chief barazas, when you have community dialogue days, then you're able to get these professionals. Various professionals in the implementation of primary healthcare do not work in silos. They work as a team. You will note that, for example, when there are what you call the community dialogue days, that is where the community engages with various professionals. For example, whoever might have convened, in most cases, the sub-county nutritionists, they get the services of agri-nutrition officers from the county departments of agriculture, their public health officers from Department of Health. They will also get so many other professionals, and then the community is able to be taught various aspects. For example, nutrition, some other aspects could include kitchen gardening, and also now the agricultural extension officers now come in where now they'll talk about these issues, about the soil, the benefits of doing soil analysis, because all that the farmer needs to understand is that at certain points in life, the soil in their land needs to be analyzed, so that then they're able to know the nutrients that they need to target with the fertilizers that they purchase, which now means that the output of their farms will be nutrition, will have all the nutrition nutrients that are required by the human to support human life. The other aspect, you also realize that in the same teams there could be apiculture officers who now talk about the bees and how you take care of it, because when we have these kinds of conversations, we not only think about nutrition, because you also need to think about something extra that this farmer needs to get at the end of the day. And all these things are very important, because even if you have that one cow at the household level, then you really need to take good care of it, because the other biggest challenge that is upcoming very fast is the issue of AMR, that is antimicrobial resistance,
right, in
the farms, and which has a direct consequent to nutrition, which means, for example, people are giving the animals antibiotics, and they pump the antibiotics 2-3 days, they change to another, and at the end of the day, these animals are consumed by us human beings. And you see, the same antibiotics that are given to animals is what is given to us as human beings when you get sick. Meaning that if there is a microbial resistance in some of these animals, the same problem will come in when you eat this meat. And that's why we are talking about we must focus on food safety as we think about nutrition.
I'm glad you brought that up, and there's something you want to say.
How do you guarantee, how can you ensure as the end user, the person who is then going to purchase, how can you ensure that what you are then buying for consumption, or whether you're, the only way you can control that is if it is you know what has gone into it, you're picking it off your little kitchen garden and things like that. But how do you ensure that the food then that you're buying, right, and that you're then consuming is met by these standards, is met by, lower levels of these dangers that you're talking about?
I'll take it back to the farmer, because some of these things are issues to do with personal responsibility and someone having that conscience that they need to protect the consumer, because the government has various laws and policies and various mechanisms, but it's the person, it's the farmer who also needs to ensure that they comply and ensure that, for example, they meet, because we have guidelines and this information is in public domain, and people keep on being given this information, and sometimes you even realize that, for example, if you're using these herbicides and pesticides, they are well indicated that you cannot harvest these crops after maybe say 3 days. You can only now harvest after the 4th day, meaning people have information. And for me, the most important thing that really needs to be done is education, because education has more impact on the end user as compared to enforcement. Enforcement is equally important, but personal responsibility is also very, very important.
Indeed.
I think the other thing is, for us, for example, if we are consuming some of these packaged foods, we really need to ensure that we read whatever is usually indicated. If you walk in any supermarket, you realize that the population doesn't check, for example, on the simple basics. For example, the expiry date of what you bought. And sometimes we have some other issues of aflatoxin,
yes,
which also has a bit of challenges, and sometimes it could cause various diseases and conditions like cancer.
Yeah.
Because that is why I'm saying the consumer has a huge responsibility on their hands, and it is all of us to make sure that you read those that information that is well indicated whenever you're buying that flour. You really need to know if the flour is white and you've taken it home, the color has changed. You really also need to know what is happening. You need to check on the expiry date of what you've bought. You need also to check on the ingredients, because there are certain populations who at some point develop allergic reactions because of ingredients of food. And you realize that still, just walk into any supermarket, look at individuals when they are purchasing some of these things. We pick, drop, no reading. So there's a bit of personal responsibility that needs to come from us.
You know something, what you're proposing is something that people actually have to be taught.
Yes.
It's not something that people will do as a knee-jerk reaction. I have a concern. We've spoken about the rural folk, and that is good.
Yes.
But there is a growing population. This urban drift, our urban centers, especially after devolution, are getting more and more people coming to them. And unfortunately, many of them live in what we call the low-rent areas, which technically are referred to as slums.
Yes.
They live in crowded areas, mostly areas that lack fundamentals of just basics that any development should bring about. They don't have it. They don't have proper sewers. The education system is limping at best. Now, these programs that we speak of,
yes,
do we have them addressing the needs of people who live in these settlements, because they really need these interventions?
Yes, you realize that in most of these areas, that is the slums, we have so many programs and activities that are geared towards these things. For example,
allow me just to pause you for just exactly 3 seconds. We have many programs that people tell us do these things.
Yes.
If they did these things and given their numbers, these problems would not exist in the magnitude that they do.
The biggest challenge in nutrition is very simple. People making the right choices. Discipline nutrition. I will pose a question to the the three of us. When you go to a wedding and you have the 3 containers, the 5 containers that you find in a wedding, excuse me, containing the various types of food, how many of us make that choice of taking starch from one plate or one dish and not the rest? You have ugali, you have mchele, you have
potatoes.
No, you must have all of them.
I mean, surely.
Sorry.
Anyway,
So they're all there.
Yes. See what I'm talking about. The reason why we have the different.
Why are you limiting my choices? See, they're all there. and then they're big plates.
That's what I'm talking about.
Big plates are meant to be filled.
The reason why we have all these other options that are usually available during these occasions is not for us to pick from all these dishes.
See.
It's basically basically for you to make the right choice that today I'm going to take potato and a bit of these green vegetables, not the cabbage that is there, and the meat that is there.
Henry,
that's it.
when we grow up, who gives us those choices? You are served food and you eat it. Is that not so?
Yes.
And we grow up even in our houses when you're working. Food is served, you eat it.
Yes.
Okay?
Yes.
So now, when you have this situation where there are all these things, you must try.
So I hear what you. So I mean, of course, the big plates and all that. But I hear what you're saying is that now the choice has to come in over anything else. That because this is valid. What CT is saying.
Yes.
That we ate food as a function,
yes,
not as a choice.
Yes.
It is not when there was a vegetable on your plate or whatever, you're not thinking, oh, this is great. Let me see what minerals are here. And, my parents are actually doing it so that, no, it's food. It's 7 p.m. It's dinner time. You eat it. You wake up in the morning. It's whatever you're going to school. It's breakfast. You eat it if you got it, right?
Yes.
Lunchtime, wherever you were, it's food as function for survival, right?
Yes.
It seems almost a luxury then.
Yes.
To then be able to select food based on what it is going to do for your body. And it seems like that's what we're saying needs to be done. But we then must retrain our minds to say what you're putting into your body is vital for survival. It is actually that what you're going to put into your body is very important in terms of then what you want to get out, long life, health, etc. Right?
Yes.
So we need to retrain our minds is what we're saying now.
Yes, because as you said, the way things are that long time ago, things have changed. The model of healthcare also has changed. The model of nutrition also needs to change, because what you talked of, micronutrients, discipline, as making those rightful choices, as understanding that I would only need today, depending on what I ate in the morning, I only need to eat a bit of meat, vegetables, and a small piece of starch, simply because today I'm not doing a lot of work. And
what do you say when you say I only need? What does that mean?
It means that as nutritionists, there's what we call as a meal plan, and meal plans are developed by nutrition professionals, which now dictates what you eat in each and every day. And sometimes coupled with nutrition education, then you're able to know that, for example, if today I'm not doing heavy tasks, then it means that I don't need to eat so much, because number one, you're empowered with nutrition information. Number two, you've made that decision, and I repeat, you've made that right decision to live a healthy life. And today maybe I don't feel like I need to do a bit of physical activity, so it only means that you need to reduce your portion. And when you reduce this portion, you only eat what your body requires and not what your body will store, because you also don't want to be overweight. Because overweight on its own, and overweight and obesity is a problem. And in fact, it was classified, I think, in some years back by World Health Organization as a disease, because with it comes a lot of other diseases and conditions, the likes of cardiovascular, the disease of the heart.
Yeah.
We have hypertension, we have diabetes type 2, we have so many other diseases. So that's why we are saying we really need to ensure that we live that healthy life. You need to ensure that our nutrition status is also at what it should be, depending on the conversation that you've held with your nutritionist.
Yeah.
Because number one, the most important thing for me to have in your life, or the best person that you need to have for everyone, is to have a personal nutritionist. Because even if you say I want to have who, you eat. You wake up in the morning, the very first thing you do is eat. So whatever you ate, I was starting, I said, whatever you put into your body, it depends. Could be a poison that you keep on putting into your body, and the end result will be a disease. Or you put in something that is healthy. At the end of the day, then it means that you've worked on your health.
That's about how you should eat. How we should eat is what nutrition then carries. But what should we be eating?
Yes. I said we started. We talked of the starch. We talked of the proteins. There is the fats, which are also very essential, and oils are very, very important. They are also fortified with vitamin A, vitamin D, vitamin E, and vitamin K. Vitamin A is very important because of our eyesight and with our immunity. We've just come from COVID, and our immunity has really showed us things. We have really struggled, and we have managed, and we are doing so well. And one of the most important thing I really need to mention is that our immunity is very important, because your immunity is what has helped you fight off diseases, be able to live that good life, and also be very productive. Because nutrition has a direct impact on your productivity as a person. That is why at some point in your life or some point in your day, you feel you're low. Sometimes you feel very agitated. You feel you don't need to work, but after you take maybe say a banana, because it has some enzymes which are very important, which sometimes you call as happy hormones, you feel you're happy and you're able to do things, your mood changes, you are able to give very good output in whatever work you're doing. And that's why I'm saying nutrition is very important, even at work. And whatever things that you're doing. And that's why we are saying it's very, very important to also consider what you put in your body.
But Henry, how then do you fight this battle where, yes, there is the knowledge that people have about nutrition, but then what we eat is also very directly attached to prestige and conspicuous consumption living, meaning when you eat certain food, it's considered to be prestigious and it's considered that you are doing well. When you eat certain food, it's consider that you are languishing in the very throes of poverty and suffering. So, and you cannot remove the psychological needs that people have from their reality.
Yes.
And the pull will be to demonstrate that my life has improved. I will eat certain foods whose nutritional value is often suspect.
What we are doing as Nutrition Association of Kenya with other associations, for example, Kenya Pediatric Association, we have Nurses Association, we have Kenya Clinical Officers Association, Gynes and Obstetricians Association, and so many associations. We have this project we are calling the championing evidence-based advocacy on primary health care and nutrition, and that is exactly what we are doing. It's under Capricorn. That is exactly what we are doing, giving information and influencers and champions in 15 counties, so that then we are able to tell them, you be our champion. And there's a time you had asked me that question.
Yes.
What are we doing?
Yes.
We have champions and influencers at county levels in 15 counties in Kenya, and we are giving and impacting these people with the information so that they also help us cascade down this information on advocacy, on good nutrition, on championing for the interest of our women and our children and our adolescents, because we really need to put much more effort on having the right information with our decision makers, because if our policies do not directly influence the population at the end, then we'll have a problem. And that's why we are trying to champion for the interest of the age groups that I've talked about. Because at the end of the day, if people have the right information, then it means they'll make the rightful choices, which also impact on their lives. And for women, it will also impact on their livelihood and their children, which is their end productive, they conceive and are pregnant.
Yeah, even as we're winding this down, the burden of disease, as we've talked about before, the cancers, the diabetes, the blood pressure, heart disease, can be linked directly to food.
Yes.
Would we then be able to see a situation if by changing the way in which we ate, we would reduce the potency of the burden of disease in this country through these ambassadors that you talk about, through these influencers that we talk about, to see that direct impact and say, look, if we change the way we eat, we change our health, essentially?
Yes. In some other countries which have been able to succeed in this, number one, they have cascaded and have nutritionists at the community level so that they give this information to the community. Number one. Number two, we have what now needs to be done at policy level, which is the issues of, for example, talk of color coding for certain foods, the foods that I talked of that are high in sugar-sweetened beverages. And what some of these countries have done is that the foods that are very high in these sugars, they are labeled, say, color green, or I mean color red. And foods that are least in terms of sugar-sweetened beverages, they are coded, for example, color green. And then the population is given information that these foods that you find being color coded green are the most healthiest options, and people are making these decisions. Number two, the population also needs to be given information, and it's being done by nutrition officers countrywide, that read food labels, understand the ingredients of these foods. Because if you understand the ingredients of this food, you make the rightful choices. And one of the things that I so believe in is that even if we are doing all this, we need to really impact on our women. Because in most cases, you realize that even if you're a man and you have your partner, who buys the food, who picks and puts in that trolley? In most cases are women.
It will make a difference.
Yes, it will make a difference because you have impacted with them with information.
Yeah.
And in some cases, who makes the decision at home what food will be cooked? Yeah. Yes.
Important conversations to have, especially when we see that this input will definitely direct the output, and we can't stop having conversations like this. Henry Ngethe, thank you for joining us this morning, and we'd like to come back again and talk about where then we have reached. Henry Ngethe is the chairman of the Nutrition Association of Kenya, talking about how nutrition does impact us as a country. Asante sana for being here this morning.
Thank you so much. I really appreciate it.
This is the Situation Room, the only way to start your day.